Schiller here, and today we're going to be talking about one of the low thyroid patterns that we call thyroid resistance. And many of you might have heard of insulin resistance, and it's kind of similar in a sense that just like insulin resistance, where you are producing enough insulin, but your body starts to cover its ears, so to speak, cover the receptors to the insulin, and not really recognize it as much. You can do the same with your thyroid hormones. You are producing enough thyroid hormone, but your body is not really listening to it anymore. You're resistant to it. So, and when I say your hormones, I'm not just talking about one marker like TSH or TSH and T4. I'm talking about looking at all your thyroid hormones, TSH, T4, T3, TBG, T3 uptake, reverse T3. On past posts, I've talked about these things, so you should look back and watch those posts to get a better idea of what I'm talking about. But just know with thyroid resistance, your body's not listening anymore. And one of the main causes is what is called stress reaction, or a relationship to a hormone called cortisol. Cortisol is made in your adrenal glands. The adrenal glands sit above your kidney, and they are the stress glands. They produce many hormones, over 50 different hormones, and one of them is called cortisol. So if cortisol is a suspect, then that needs to be checked in the appropriate way. Now, most people will get their cortisol checked in blood, in serum, and typically they'll check the blood whenever they checked your blood, whether it be in the morning or afternoon. But just know that cortisol has a rhythm. Cortisol has a rhythm of being high in the morning and then low towards evening. This is what wakes you up, and this is what, when it goes down, it actually allows you to go to sleep. So when you're just checking the hormone in the morning and not checking it throughout the day, then you're going to have a limited view on how that cortisol is doing. So typically in the blood, and obviously if you think about it, when you're getting your blood checked, you're not going to go back to the lab 4 times in a day to get the rhythm of this cortisol. So a better way to get your cortisol checked is what is called a saliva check, so that you can take this kit home with you and you basically either spit into a tube or put a cotton swab in your mouth to saturate that with your saliva. And those saliva measurements are looking at the cortisol at different places during the day, so that you can get the idea of how your rhythm is doing. Another reason why you could have thyroid resistance is due to a marker on the rise. Homocysteine is a marker that you can look at in your serum, in your blood, and it's basically an inflammatory marker. And people that have high homocysteine, by the way, do have higher cardiovascular risk. High homocysteine means that your liver's not working too well, because homocysteine, if it starts to go up, it's not being converted back to an amino acid called methionine. And that's done in the liver. So homocysteine should also be a suspect if you are having thyroid symptoms and all your markers are coming back normal. Again, not just TSH and T4, but all your markers. And in past posts, I talked about these things. So if you have a suspicion of a lot of thyroid symptoms, but yet your markers are coming back normal, you should be looking at your cortisol, or you should be looking at your homocysteine. So you should be finding a doctor who has an understanding of these things, so that they can get to the bottom of your problem, so that you can really find out why you still have thyroid symptoms, but yet nothing is helping you. So I'd like to thank you for watching. I'll hope to see you on future posts, and make it a great day.